Over the years, I've tried to create a patient experience as good or better than anybody's. And what that means is I've put together a fantastic team of people. From the time your phone call's answered to your appointment scheduled, you feel well cared for. Then you get to meet me, and of course that's fantastic. Then you spend time with my care coordinator, and each step of the process, everybody has a good experience. Personally, I try to be approachable and humorous. I try to get the staff to be informative and educational. We try to keep our costs reasonable, at least competitive with the marketplace.
After, when you come in to see Dr. Lussier, you come in to see me. I'm Sheila McCart, and I am Dr. Mark Lussier's patient coordinator, and I do ask you for your money. No, I'm just kidding. We go over the financial stuff. I go over the do's, the don'ts. We give you a folder that has all of the information in it. It has your consents that you've signed. And then I also give you my card, so you can call me because it is overwhelming and a lot of information at one setting. We do have a certain protocol that we do. It might be a little different than other surgeons, but we want the experience to be great.
Well, the very concrete factors are you want to meet the staff and make sure you like the staff. You meet the doctor, like the doctor, and make sure that he or she is appropriately credentialed. And then to have an exam and make sure that you and the doctor have communicated well what is bothering you and that the doctor understands and has a solution that he can present to you that makes sense. So that by the end of the consultation, you understand what the problem is, what the surgeon's proposing, then what are the possible outcomes, and how much it costs.
You've had time to review that, write down any questions that you may have, and bring that in for Dr. Lussier to answer, or myself. And when you come in to see him, he will go over medications with you. He will take photos. We call them pre-op photos, just so we can have before and after.
Initially, we take photographs because I need to use them for preoperative planning. And then from there, we document the progress as people heal. And often people forget what they look like pre-op, and they're wondering why they didn't get a bigger result. And then I put the preoperative pictures juxtaposed to the post-op pictures, and everybody usually sits down and says, I see it. And those are the essence of having a consultation. It's very busy. I think a lot of people come to us from other practices and don't have a really good understanding about what had happened. We try to spend a lot of time educating the patients, both from my side, which is the surgeon's point of view, but also from my staff's point of view, because they've often had many of these procedures themselves. And they can sympathize or empathize as a potential patient. And I think the more that people understand what's going to happen on both sides of the table, meaning the doctor's side as well as the patient's side, that they can leave confident that they're in the right place.
The best thing about that is that they see that we care. They see that we're there for them, and they end up coming back in for another procedure. And that is super rewarding on our end, and that's why I think patients love us as much as we love them.